safe to have a hospital birth? Hi, I'm Brittany with Beautifully Connected. I'm a birth doula, massage therapist, and I practice herbals with the Wise Woman method. Welcome to my channel. That might seem like a really strange question to a lot of people because recent studies have shown that only 3 to 4% of women give birth outside of a hospital. So me posing that as a question is a little bit strange because most people are mainstream and go to the hospital. But I would like to ask that question so that it really provokes some thought in your minds. Just because everybody is doing it, does that necessarily mean that it's safe? A study that was done by the government showed that complications in the hospital for childbirth have risen 45% between the years 2006 and 2015. So that's like less than a 10-year span. What has happened in this 10 years? Have people gotten more sick? Have people gotten higher blood pressure? In 10 years, have people's diets changed that much? Are people that much more overweight or that much more high risk in 10 years? Or is the maternal health care system failing us as women who are going into the hospitals? So that's an interesting question. This study also found that there was more disparities or more instances of morbidity or mortality for minority women, Black women, and women who are low income or on Medicaid or some other sort of state insurance. So I want to especially reach out to the people who might be watching on my YouTube channel to gain extra information because maybe you are a low-income person and maybe you can't afford a childbirth education class or maybe you can't afford an out-of-hospital birth experience. I want you to really question the safety, though, of walking into the hospital and just doing whatever the doctor says. Because this study has shown us that especially people who are poor, especially people who are minority, are feeling the effects of hospital birth and what hospital birth is doing to us in terms of complications and death. So I would like to really just explore what happens at a hospital birth and give you some information, some tools of how to combat some of these negative outcomes. So there's a very interesting theory that in the hospital, there are more complications than at home simply because there's more intervention. So we know now a lot about hormones and physiology of birth and biology in regards to birth. Much more than we knew when we were developing obstetrics some 200 years ago. So now we know that hormones play a very important part in birth. So if we are sending women who are not really high risk and don't have any medical problems in for inductions, we are giving them a cocktail of synthetic hormones and messing with their hormones that naturally would send them into labor for their baby to be born safely. So naturally, in a physiological birth experience, we have this wonderful cocktail of natural hormones that helps us progress through labor. It helps us contract, and it gives off pain relief and endorphins for us every time we have a contraction, and oxytocin, which helps us have productive contractions, but also helps us not hemorrhage to death. So we have all of these wonderful hormones that work for our body for pain relief and to keep us safe, to keep our body safe and our baby safe. All of these things are disrupted when we add an element of hormones or synthetic hormones or any kind of disturbance to that physiological process. So for instance, when you go into a hospital setting, now I've been a doula for four years, since 2014, it's 2018 now. When you go into a hospital setting as a pregnant woman, the first thing that they want to do is they want to check your cervix. And if you are in labor or they think you might be in labor, that's the first thing that they do. For any of you who have not had kids before, or maybe you're a male or you're just looking to get some more information about birth, that's not a very comfortable procedure. So if you can imagine for a minute that you're contracting well and maybe you are having some pain and you're not really feeling like you want other people to touch you and you're comfortable in your own home, then you make the long drive to the hospital. Then you go to the hospital, and then suddenly there's these medical practitioners, and these medical people want to stick their hands inside of an organ that is a very sacred organ and a very personal organ. Meanwhile, your partner is going to be standing by and probably observing some other medical person inserting their hands into your private area and space. So not only can that be very disrupting and discomfortable for you, but it can be very disruptable and discomforting to your partner. So I think that's very important to understand that just that disruption alone, it's common, it happens in all the hospitals. They do it often, but it doesn't necessarily mean that it's good or okay. And that really messes with your physiology, because if you have all your oxytocin, which is your love hormone and your happy place, if you have all that flowing and you're doing well and you're coping well with your labor and your contractions and you're doing well with your partner, and then you go into this hospital space, what do you think happens when somebody in essence violates you? Now, I'm not saying that there's never an indication for a cervical exam, but I am saying that, is it right that we just do cervical examinations on every single woman who walks into a labor ward for any single purpose? I think that there needs to be a little bit more thought or education put into that intervention alone. Then if you're going through the birthing process and they've checked your cervix and they found, yes, you're contracting and you're dilating, you really are in labor, they're going to want to send you off into a labor room or out of that triage area wherever you were before, and they're going to want to do IVs, they're going to want to do hep blocks, they're going to want to take blood to make sure that your blood is healthy enough for you to either have an epidural, or to make sure that you have enough platelets so that you won't hemorrhage or that you're not a risk for hemorrhage. So they're going to be doing all of these blood tests, which again, that's another intervention. And if you're in the middle of contracting and laboring and they're shooting you with needles and all these things, that's not comfortable for a person who is not already having this large experience. So imagine going through something very large and then having to deal with all that in terms of your pain. That's just very difficult. Meanwhile, your partner is still watching all this. Hopefully they're with you. So after that, you're going to be laboring in your hospital room. Many hospitals, especially in Oklahoma, if your water breaks, they want you to stay in bed. It's hospital policy, it's not law, you can do what you want. But this is what happens to most women. So most women are stuck in bed, and at this point they want pain relief, obviously. Because if you're not able to move with your body and work through your pain, you're going to be in more pain. So that is a disruption to the entire physiological process. And sometimes your epidural could be ascending instead of descending. So that means they give you the epidural and then you have a numbness sensation going upwards instead of going down. So imagine like being able to feel all the body sensations of labor and then having absolutely nothing up top and feeling like you have an elephant sitting on your chest or like you can't breathe correctly. That would be a really terrifying experience for anybody, but especially for somebody in labor. So, and then with the epidural, you're stuck in one position. So many times, or rather in physiological labor, women would be up and moving around and coping with their pains and moving their pelvis. And all that movement really helps baby get twisted and descended into the pelvis and ready for birth. If you're flat on your back and you're unable to move, you're unable to move your pelvis. So many women have been told things like your pelvis is too small, or your body just can't do it, or you just can't give birth, when in fact it might be you had an intervention that prevented you from being able to physiologically give birth. So my argument today is that maybe it's all of these interventions that we throw into these laboring people instead of birth itself. Birth is not dangerous, intervention is dangerous. A very wonderful midwife named Carla Hartley said that in one of her books, and it's very wise. When you look at physiological birth and physiological labor, it's not dangerous. We have all of these safeguards, we have all of these hormones, and we have all of these things in place in our body that makes us strong and capable and powerful and able to birth babies. When you look at taking women out of their natural place where they're safe and they feel comforted and they feel at home, and you put them into this medical setting where there's lots of bright lights, lots of people they don't know, lots of people touching areas that are private and sacred to them, lots of interventions, lots of synthetic hormones, epidurals and pain relief. These things are great. Modern medicine has saved many lives. But now we need to look at what's happening with our complications that are arising for women in birth. And this is especially, again, affecting people, minority, low income. So if you're one of these women who are watching, it is important for you to pay attention to this. You need to understand that you have the power to say no to any intervention when you walk into the hospital. From any intervention, from that initial cervical exam to that epidural, to that IV, to the Pitocin, to any other thing that they want to do to you. You are able to educate yourself about physiological birth, and you can say no. If you have a nurse come in who is on call and taking care of you, and you really don't jive with her, it is within your rights and within your power to ask her to leave, to ask for a different nurse. I promise you, you are not inconveniencing the hospital when you ask this. If you are not getting along with your nurse, chances are she's not getting along with you and she would rather deal with the patient that she jives better with. So go ahead and request somebody different. Same thing for on-call doctors. There's usually a head attending doctor at a hospital, and you can always request a different doctor. For many of us, it's very rare that the OB we see during our care is actually the OB who shows up during delivery or who manages our labor. So I think it's very important to understand that if an on-call doctor is telling you something, telling you you need a certain intervention or medication that you are not comfortable with, it is well within your rights to request to speak to your doctor or to request to have your care transferred to a different doctor. And these are just some very simple ways that we can try to help and protect ourselves and keep ourselves safe from all of the interventions that we find in the hospital. Thanks for watching. Make sure you hit the subscribe button if you like this video. Also, if you have any questions about holistic health, be sure to put those in the comments for me.